IVM.
Hi, everybody. On behalf of the team at IVM Podcast, I have a request for you. We'd really appreciate it if you could go to ivmpodcast.com/survey and fill out our survey over there. It's going to take a few minutes to do, but it gives us some really interesting information that we can take to advertisers and brands about who's listening to the network. If you're comfortable giving us your email address, while you're filling out the survey, we'll enter you into a random drawing where we'll be sending out a bunch of IVM swag to some of our listeners. Last year, we sent out coffee mugs, and this year, we're hoping to send out much cooler stuff. That's ivmpodcast.com/survey. We really appreciate your help.
Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to All Things Policy. The National Family Health Survey has come out. It's a periodic survey of families across the country in various states that comes out every few years. It was slightly delayed because of the onset of the COVID-19 pandemic, as you can imagine. But there's a bunch of really interesting findings that we're going to be dissecting over the course of this episode. The first thing, of course, that comes up is that India seems to be doing decently enough in terms of various infrastructural markers. But there's also some points for major concern, especially the fact that child malnutrition is once again on the rise. Now, to discuss this with me, I have today Shambhavi and Sunila. Hi, guys. Welcome.
Hi, Anirudh.
Hey, Anirudh. Hey, everybody.
So let's get straight into it. Sunila, can you walk us through some of the big findings of the survey? But actually, even before that, can you tell us how this survey actually operates? How frequently do results come out? And how is it actually conducted? What kind of sample size do we see? And then maybe we can get into the kind of conclusions that the latest survey shows us.
Yes, thanks, Anirudh. The National Family Health Survey, it's a survey that provides information on population health and nutrition indicators for India and for each state and union territories. Till now, 4 surveys have been conducted, and just now that has come is the 5th one. So normally it is conducted by the Ministry of Health and Family Welfare in collaboration with the International Institute for Population Sciences. This time, only the phase 1 results have come out. So the phase 1 includes 17 states and 5 union territories. And the rest of the states, the data hasn't come out because of the COVID-19 pandemic. They were not able to collect the data on time. Now, the objective of the survey is basically to provide essential data on health and family welfare, as well as data on emerging issues in these areas. So the information collected through these surveys is intended to assist policymakers and program managers in setting parameters and benchmarks and examining progress over time in India's health sector. And besides providing empirical data and evidence of the effectiveness of ongoing programs, the surveys also help to identify the need for new programs in specific health areas. Now, since the complete data is not available for NFHS 5, I'm not sure what sampling method they used here, but all I know is that for this time there were around 6.1 lakh households that they surveyed. In the last survey, they had used stratified 2-stage sampling. So what happens in stratified sampling is that there's a heterogeneous population and then you divide them into homogeneous groups. Now, in the last survey, in rural areas, they had used villages as sampling units. And for urban areas, they had used census enumeration blocks as the sampling units. And these sampling units, then they are further divided into groups based on some common characteristic to make them a homogeneous group. So that's the method that they had used in the last survey. We don't have enough information on the sampling technique used this time. So we'll have to wait until they release the data at national level as well. Right now, we just have data at state level, and that too for just 17 of them. So there's not much I can explain about the sampling technique right now for this round.
Okay, fair enough. So let's actually get into the conclusions that can be drawn, right? You said that one of the reasons why the surveys are conducted is so we can figure out what kind of policies need to be implemented. So let's try to do that. Let's first try to understand what the data are telling us, and then we can try to suggest perhaps or work out some kind of policy solution to all of them. So what do you think, Sunila? Like, what can we tell from the results of the states that have come out so far?
Yeah, so few of the indicators, the states have been faring well on those indicators. For example, when it comes to population, according to the results that are available now, it seems that the population is stabilizing because the total fertility rate is going down across majority of states, except for Bihar, Manipur, and Meghalaya. So the majority of the states, they have total fertility rate lesser than or equal to 2.1. Total fertility rate is the total number of children that would be born to a woman if she were to live to the end of her childbearing years and give birth to children with the prevailing age-specific fertility rates. Now, a total fertility rate of 2.1 is considered to be ideal one because it helps to stabilize the population. So that's a good thing that most of the states are exhibiting a total fertility rate of less than or equal to 2.1. And when it comes to family planning, the contraceptive use has been on the rise, which is a good thing. And the unmet need for family planning has gone down. The unmet need here means that the number of women, a number of people who are willing to adopt family planning methods but are not able to access it. So that's the unmet need. And fortunately, it is going down. Overall, the family planning area seems to be doing well according to the results that have come out. However, there's this one point that I would like to talk about. When it comes to methods in family planning, female sterilization, it dominates the contraception in most of the states. And unfortunately, male involvement in family planning is very disappointing. Across many of the states, the percentage of males going through sterilization is just like 0.1% or 0.2%. So that's about population and family planning that we can tell through the results that have come out till now.
And also, infant mortality rate has decreased, right, in some states?
Yes, infant mortality and under 5 mortality rate has gone down in 18 of the states, and in fact, the neonatal mortality rate as well it has gone down. So that's a major positive indicator actually.
So I think one broad conclusion that seems apparent is that pre-existing measures that were already there, pre-existing policies, pre-existing programs have kind of continued the trend that they were on, right? So over the last few years, we've continued to make progress on the big things. But there are also so even though broadly we can say public health programs are doing their work, there are also some areas that we're not doing as well in, which can be connected to, I think, somewhat more transitory economic effects, which still need serious attention, of course. But I think one of them is malnutrition, right? So, like, what are the takeaways on malnutrition, Sunila?
Yes, the most concerning findings are related to nutrition in children, and what we have found out through NFHS 5 is that malnutrition is on the rise among children. Now, the three most important indicators that are used to measure child undernutrition is stunting. Stunting is low height for age, wasting, which means low weight for height, and underweight means low weight for age. Now, India has the largest number of stunted children in the world and among the highest share of stunted children of any country outside sub-Saharan Africa. However, between 2005-6 and 2015-16, when the two previous rounds of NFHs were conducted, India made substantial progress, lowering the share of stunted children by nearly 10 percentage points. However, this round indicates that the last 5 years could have actually reversed many of these gains. the share of stunted, wasted, and underweight children has grown in majority of states such as Kerala, Gujarat, Maharashtra, Goa, and Himachal Pradesh, all of which actually had lowered their rates of stunting in the previous decade. So this is very concerning actually, because when it comes to health of a country, we actually look at maternal and child health indicators. And if the indicators for these are not going down, they should at least they should at least not change. But having a rise in all of these indicators points to a very concerning trend here. Like maybe we are not doing enough through schemes like ICDS, or maybe it's not just the public health programs. It could be related to how the country is performing economically as well. India is facing economic slowdown since last few quarters, and that could be one of the reasons when it comes to malnutrition in children.
Yeah, I would definitely think that's a really big reason. Families need to have enough money to be able to keep their kids at home and to actually be able to feed them. I don't know if we can say that midday meal programs and all are failing. I will just say in passing though that there have been controversies over the quality of nutrition that's being provided in midday meal programs, and now we're seeing that malnutrition rates are increasing. So maybe that's something to look at. At least for me, I think one really important takeaway is that, as you said, Sunila, this is extremely concerning. It's something that needs to be addressed quickly. But the way I see it is that it's part of a larger economic problem that needs to be addressed. We hear so much about India's youth dividend and all that, and increasingly it feels like the economy is simply not taking advantage of that. We just recorded an episode recently about the kind of shortage that we're facing in terms of medically trained staff. So clearly there is a massive missed opportunity here. If incomes were rising, I get the feeling that children would not be having issues with malnutrition because families would be able to feed them better. But yeah, clearly it's part of a problem and it needs urgently to be addressed. Shambhavi, what are your thoughts?
Yeah, so it's I think a few decades ago, the main question before India was food security, right? And I think we have answered that. And now we have come to the next stage of where we have to make sure that there is nutritional security. And both in terms of stunting as well as obesity. I think the survey has shown that both are on the rise among younger children, which is really very scary. It means that there are some kids who are not eating nutritious food, but are eating a lot of everything else. And there are some children who probably don't have access to food at all, nutrition or otherwise, and that's causing malnutrition. And we need to address stuff at both ends of the spectrum. And you're right, this could be an economic problem. There's also a facet here of the fact that we have not been able to utilize our scientific progress as well as we should be. I know there's a tremendous controversy about using genetically modified foods. There was this idea of golden rice, which was nutritionally fortified rice. They did some field trials in a few villages in Maharashtra and in other states, where there seemed to have been some benefit that the children who are eating this golden rice got. Obviously, there are both sides of the story. There have also been publications that say that golden rice is not as nutritious, and perhaps there is further studies that are required to figure out how good or bad this is. But these are things that Indian government can do, right? We have to be more proactive in recognizing the fact that there are kids who might not be able to get the most nutritious food because of the economic constraints that their families have. That our midday meal programs might not be good enough to provide them the nutrition. And if there is scientific evidence that suggests that there are things that we can do, India has to act upon that now.
Yeah, and I would like to add something to that. So you spoke about the number of obese children increasing as well. In 2017, the ICMR had come out with the state-level disease burden report. And the report specifically pointed out that India is going through epidemiological transition where it is facing a dual burden of undernutrition and malnutrition. So that's a very challenging problem to address, I think. And the findings of NFHS 5 actually reinforce what the report mentions. So, it is extremely worrisome that while the number of children who are facing undernutrition is increasing, at the same time, children who are obese is also increasing. So I think it really boils down to the diet that the children are following, and it's not just what the children from very well-to-do households are eating, right? Because obesity can occur in children from poor households as well, because they sometimes they don't have enough money to buy nutritious foods, and then they resort to cheap, easily available junk foods. So this is what we need to think about as well.
Hearing both of your views, I mean, I'm trying to realize just what a wide-ranging problem this actually hints at. And I think one thing that I really agree with Shambhavi is a strangely dismissive attitude towards science. I mean, if you have stuff that is scientifically proven that it could potentially work, I don't see why that can't be promoted. It's rather ironic to me that the government will promote homeopathy and an ancient medical tradition, but will not promote modern science in order to lead to better nutritional outcomes. And at the same time, you also see stuff like, for example, beef bans in various parts of the country. Right now, I will leave the religious reasoning for beef bans out of the equation. But the fact remains that for many low-income families, beef is a primary source of protein for their kids. And if you take that off the menu for them, then you're only worsening the malnutrition problem. And it seems to me that in this, when you tend to prioritize cultural or religious sentiments over science and metrics that are empirically proven to lead to better outcomes for India's citizens, you tend to see results like this over the long term. And what we can say at least is that now that we have the data, now that we know that these policies aren't working, then there is a strong case to be made for course correction and moving back to scientifically proven methods. But that's my point of view. What do you guys think?
To be fair, I mean, I don't know about genetically modified foods, but the government is actually working on providing fortified food to children. The World Food Program in India is doing some incredible work in providing fortified rice, oil, milk to children through Anganwadis and ICDS. I am not sure Shambhavi will be able to better articulate about genetically modified foods. But I do know that they are working on fortifying oil, rice, milk, and flour.
Okay, fair enough.
I agree. And I think the government is doing things, right? It's not yet giving the results that we wanted to. So the question is, what more can we do? I mean, the midday meal program, I think, was a revolution of sorts in getting more children to eat and go to school. But if rice and dal is what you're giving, then the other question is, how can you, now you've got this opportunity, you know that this works. How can we actually improve on it? Considering that the survey is telling us that, yes, it probably managed to tick mark one checkbox of food security, but clearly we are falling short on the malnutrition bit.
Also, we need to consider other social factors when it comes to child nutrition. We really need to give importance to mother's education and her nutritional status as well. When we talk about nutrition, we cannot not talk about the availability of safe sanitation facilities. So yeah, I guess we need to focus on that as well. We need to have a holistic approach.
Yeah, sanitation and drinking water. I think two things that we really need to focus on.
But doesn't the latest survey indicate that at least some progress is being made on those fronts? More households have access to cleaner fuel. Most households have access to toilet facilities, for example.
Yeah, I mean, that's why I'm actually confused as to why this is happening, because Shambhavi and I did an episode on sanitation some time ago, and we were talking about how India is actually making progress considerably on the sanitation front. And like more than 90% of the households now have access to a sanitation facility. So this is a question to me as well, as like, why is this happening?
Okay, so one other thing I wanted to ask about was this urban legend that's been going on about how Indians, because we have better immunities or have been better vaccinated, that we have better immunity to COVID-19. Now, is there anything to support this inference, or at least anything to any information about vaccination in the NFHS results, Sunila?
I don't know how true it is like, I don't know how true what you said is, but according to NFHS 5, the vaccination rates have actually gone up. Of the 22 states and the union territories that were surveyed in this phase, 18 have reported an increase in their rates of child vaccination. More than 70% of children under the age of 2 are fully vaccinated. This means they have received at least one dose of BCG vaccine, which protects against tuberculosis. And going back to what you said, BCG vaccine was actually considered as a cure of COVID-19 as well. So maybe, I don't know, that could be one of the reasons. So this means one dose of BCG vaccine, which protects against tuberculosis, 3 doses of DPT vaccine, which protects against diphtheria, whooping cough, and tetanus, and 3 doses of polio vaccine, and 1 dose of measles vaccine. So the overall gains in child vaccination have to some extent offset the declines of the early 2000s. So this is something that we should be proud of, actually. More than 70% of children fully vaccinated is a really good thing.
Yeah, and Sunila, not cures, it protects from. It
Yeah,
has
sorry.
been suggested that it protects
sorry.
from.
That was a wrong usage of word on my part. Yeah.
But I think India's vaccination program is one case study of when there is political will to get something done and enough ground support that has come from voluntary organizations. We can get stuff done, right? I mean, we have been vaccinating children for a long time and we're getting pretty good at it. I mean, vaccination rivals only drinking water in providing survivability. That's probably one of the reasons why our IMR is also going down. There's a little concern that because of COVID-19, immunization rates for this year might be low because people have not been able to go out and reach children, or children have not been able to go get the vaccination. So there is likely going to be an impact of that again on an IMR in the coming years. That's something we need to watch out for and probably try and compensate for that by ensuring that children who are at risk do get nutritious food. I think that's going to be very important over the next decade or so.
Agreed. Okay, cool. Thank you guys so much. I think that there are some interesting, if somewhat disturbing results that I can come away with from the NFHS results. And there's still a long way for India to go. Just a reminder to everyone who may be listening to this podcast. It's a little jarring sometimes for me personally, essentially living a first world life sitting in India, to be reminded of just how many millions of people still need access to basic amenities across the country, and just how much work remains to be done to bring our public health system and indicators on par with the rest of the world. So thank you both for this. Thank you, Shambhavi. Thank you, Sunila. I learned a lot from this conversation. And thank you all for listening to All Things Policy.
Thanks, Anirudh.
Thank you, everyone.
Please consider signing up for Takshashila's courses. Applications are now open and you can apply at www.takshashila.org.in/courses. If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
I hope you enjoyed that show. If you aren't following us on social media, please do. We're IVM Podcasts on Twitter, Facebook, and Instagram. I wanted to kind of just give a quick reminder to everybody. As I mentioned up top, we are doing our annual listener survey right now. If you could please go and take a couple of minutes out of your day and fill it out, we would really, really appreciate it. It's ivmpodcast.com/survey. If you're comfortable giving us your email address, we'll enter you into a random drawing, and we're going to be sending out swag to a bunch of randomly selected listeners. So do definitely get on board that train. Let me tell you a little bit about what we did on the network this week. We launched a new show called Zindagi Diaries with Ragini Kumar. Many of you might have seen Ragini on television during the IPL. She's a presenter, but she's showing a different side of herself over here with a poetry podcast. Give it a shot, give it a listen. Let me know what you all think. Vishal Gondal is back this week after a while. He's been on an extended break, but he has Rahul Narvekar for the first episode. Really interesting conversation. Do check it out. Raji Samant joins Gauri Devidayal on This Round Is On Me to talk about the wine business and what's going on there. We had a number of conversations about the Farmers' Bill and the surrounding agitation this week on the network as well. Maruk Inayat had a great episode on the note. Puliabazi did a deep dive into the issues around this. And on Siders, we have our typical, fun conversation about this stuff with a little bit of a seriousness, a little bit of fun. Do check that out on Cock and Bull on Thursday last week. Akash Mehta joined us for that episode. And with that, I hope to see you again next week.
Whether you're an established sports person or a budding one, or simply a sports enthusiast, join us, Tanvi and Shlok.
We are two passionate pro badminton players talking policy, mindset and everything sport.
So tune in to The Millennial Athlete every Monday.
Only on the IVM Podcast Network.
Trust us, it's gonna be lit.